HIV/AIDS is a condition that causes so much fear in people just upon hearing the name. But this shouldn't prevent us from mentioning it. According to Ghana AIDS Commission, over 300,000 people are living with AIDS. And out of this 300 population, 65% are women. In this episode, Nurse Rita will educate us on HIV/AIDS. Welcome to HEALTHLINK TV show with Miss Stella, your host and your midwife. This show is proudly sponsored by Moose Condoms, Home Fresh, and B&D Medical Laboratories. To prevent STIs, always remember to use Moose Condoms. They are available in all pharmacy shops. For bulk purchase, contact 0544 34 3678. Let's go for a breather. When we come back, we start our discussion on HIV/AIDS.
Where does HIV come from? For some of us who remember the sudden emergence of HIV into the popular culture and awareness of the US in the early 1980s, HIV appears to have come from nowhere. Rumors swirled about where it came from, how it came to infect people from all walks of life around the world. It's only now, after over 25 years of research and discovery, that we can finally start to say with some confidence where HIV came from. HIV is a lentivirus on the basis of its genome and life cycle. It's not all that unusual for the lentiviruses. It infects immune cells, primarily CD4 positive T cells and macrophages. The other lentiviruses pursue similar, if slightly different, life cycles. There are lentiviruses that infect cats, goats, horses, sheep, cows, and monkeys. There's even a puma lentivirus. Not all of them cause disease under certain conditions. For example, the simian immunodeficiency virus strain that infects African green monkeys doesn't usually cause much disease to its host. The rhesus macaque also has a strain of SIV that causes little or no disease. However, if you take a rhesus macaque, a monkey from Asia, and infect it with the SIV from the African monkey, or if you infect the African monkey with the Asian virus, the result is called simian AIDS, and it parallels what we see in humans. This observation led scientists to suspect that HIV has not been a human virus for very long. If it was a virus with a lot of history with humans, it's unlikely that it would still be so pathogenic. Where could HIV have come from? We sequenced the genome of thousands of strains of HIV. And while there was an incredible diversity of sequences at certain locations, they all had a strong homology to various SIV strains. We usually break up the strains of HIV into two main groups, the HIV-1 and HIV-2 species. The closest relative, according to sequence variations, for the HIV-1 strain was the SIV that infects chimpanzees. The closest relative of HIV-2, a viral species largely found in Africa, appears to be the SIV found in Sudi mangabes. Africa possesses far more of the subgroupings of HIV than any other continent. Europe and North America are dominated by a very narrow range of viral types, the Group M subtype B. This is suggestive but not confirmatory of an African origin for the parent strains. We know that SIV and HIV are both spread in the same ways, sex and blood transfers. Blood-to-blood exposures, however, are 900 times more likely to result in infection than sex contact. It's therefore likely that the transmission from primate to human, called a zoonotic event, was the result of hunters trapping, butchering, and eating chimps. The practice of hunting primates for what is called bushmeat is well documented in tribal groups in certain areas. So we have a strong suggestion of where to look: African monkeys. In fact, evidence of viral evolution suggested a certain region of western equatorial Africa. It was here that a colony of chimpanzees were found with a close relative of the ancestral strain of HIV. Look again at the distribution of HIV clades around the world. Note that there is profoundly more diversity in Africa. How could we account for that if every continent had been infected at roughly the same time by the same virus? Here are the figures for the number infected. Why would Africa have such a high prevalence and only in certain areas? We could implicate cultural differences, but then why is there such a gradient of infection across African nations of similar culture and population composition? If all these populations were simultaneously infected, why would such large differences be apparent?
Welcome back. I have with me Nurse Rita from Shai Osudoku District Hospital. She is here to educate us on HIV/AIDS. Nurse Rita, you are welcome.
Thank you.
What is the difference between HIV and AIDS?
Okay, so in my counseling room with my clients, for them to really understand me, what I tell them is that HIV is like mosquito, and then malaria is like AIDS. So in other words, HIV is a virus that can cause an infection, but AIDS is a condition. So like we say it, the acronym, Acquired Immunodeficiency Syndrome. So you see, the syndrome is a collection of symptoms and signs together, and that is what we call the AIDS. So it's a condition, but HIV is just a virus that causes the AIDS.
Okay, so can someone be having HIV without having AIDS?
Well, yes, it depends. If you have HIV and you are put on medication, it will not progress to AIDS.
Okay.
Stage 3 form of HIV is what we call the AIDS.
Okay.
So you can have HIV and not progress to AIDS. AIDS is actually the sickness. So when you are sick with different sets of signs and symptoms, then we say you have AIDS. So we have a lot of people carrying HIV but have not progressed to AIDS.
Right. When you take the HIV kit, they've written HIV1, HIV2. So is the HIV2 the same as AIDS?
No.
Okay.
HIV1, HIV2 is just types. It's
Right.
the same HIV, but we have type 1, type 2, just like we have in human papilloma virus. You know, we have types, type 17, type 18.
Right.
It's just the same. It's just the same, just that when it comes to the treatment we give to type 1 is different from what we will give to type 2, but it's HIV. As for AIDS, when we are talking about AIDS, it means that the person has progressed. Now, the HIV has caused a disease in the person. That is where we say the person has AIDS.
Meaning both HIV1 and HIV2 can progress to AIDS,
Of
right?
course, without treatment.
Wow. And what are some of the major causes of HIV/AIDS?
So we say risk factors.
Wow.
Things that will predispose one to having HIV.
Okay.
We have the first of all, we have unprotected sex.
Okay.
And this includes gayism, lesbianism, whatever it is. If it is unprotected, it means you are predisposed to having HIV. We have mother-to-child transmission, what we call vertical transmission. If a mother is pregnant and not put on medication, she can transmit the infection to the child. And then, of course, we have use of sharp objects, talking about syringe used by people who use drugs, and then even in the house, use blade by an infected person, or even knives.
Okay. But I learned that the placenta, which locally known as itrade, prevents the baby from getting some infections. So does it mean that HIV can be transferred into the baby while the baby is in the mother's womb?
Yes, of course. Research has shown that there are 3 ways of a child becoming infected.
Okay.
During pregnancy, as the child is in the womb,
Okay.
or during delivery. And the third one is when breastfeeding. So these 3 modes of transmission is possible, meaning that if the child doesn't get it whilst in utero, during delivery, the child can get it. If he or she doesn't get it at that time, then during breastfeeding, the child can get it.
Wow. And per your experience, I know you've met a lot of cases. What are some of the disheartening situations that could have been prevented?
Well, I would say outrightly, mother-to-child prevention. A pregnant woman who is diagnosed and is offered treatment but refuses to take it, and then transmits the condition to the child.
Okay.
And you know, in Ghana, every pregnant woman is screened for HIV. When you are positive, you are put on medication, or you are advised or encouraged to take ARVs. But we have mothers who believe their pastors so much that they wouldn't believe what you are telling them, your diagnosis, and rather resort to the pastor for prayers, and then the child eventually gets infected. And these are ways we could actually have prevented it. But because the mothers refuse treatment, these innocent children become HIV positive.
That's unfortunate.
Very, very unfortunate.
So how many times do you run HIV tests for pregnant women?
3 times.
Oh, okay.
First trimester, second trimester, and then the third trimester.
Kindly break it down for us.
Oh, so we have 9 months.
Okay.
So we have 3 months. First 3 months.
Right.
Second 3 months.
Okay.
And then the third 3 months.
Okay.
So like from first contact with the patient by the midwife, she screens. If the woman is negative, then during the 4th month, 5th month, or the 6th month, anytime in between, the pregnant woman is screened again. If she's negative, then the last 3 months of her pregnancy, she's screened again. But if she's screened the first time and she's positive, she's offered the ARVs. And then there's no need for us to test the second and the third time, because those ones are actually to pick the HIV infection. So if she's not, then if she is in the first instance, then there's no need doing the second and the third one.
Won't the ART medication affect the baby in vitro, in the womb?
No, it actually helps. You know, we have 7 steps or 7 ways of HIV actually maturing, becoming a full-blown HIV. Okay. And so this medication actually halts the steps.
Wow.
You get it?
Okay.
So taking the medication as soon as possible is even the best.
Okay. Right. And I want to find out whether you conduct HIV tests for mothers after delivery.
No.
Why?
We will do that when the mother is showing signs and symptoms of HIV, or the baby is showing signs and symptoms. Then we test for the baby and the mother as well. But if the mother is healthy, naturally, we wouldn't want to test for HIV.
Okay. I'm asking because there are certain situations that you said an expectant mother needs to undergo HIV screening for 3 times. In case the woman doesn't undergo screening for the second and third time, meaning the child can be exposed to it per what you said.
Of course.
So in case the woman gets into labor and deliver the baby, without you conducting the HIV screening, the mother can transfer it to the baby. Don't you think it's necessary for you to conduct another test after delivery?
Okay. So you know, every pregnant woman is given Road to Health book, what they call the Red Book.
Okay.
There's an indication of first test, second test, third test.
Okay.
And so when you test for the first one, you document the date and the results.
Okay.
Meaning that if the woman is in labor and she goes to the labor ward and the second and the third one has not been done, the midwife then goes ahead to test because she knows that the second and the third one wasn't done.
Okay, so there's documentation. So the midwife will refer to it before delivery.
Exactly.
Then that's a good thing.
Oh, yeah.
That's a good thing. How do you prevent mother-to-child transmission?
First of all, during pregnancy, we offer the ART medications.
Okay.
And then after delivery, we educate the mother. She's not supposed to use her toothbrush for the baby.
Okay.
She's not supposed to use her used blade or razor blades for the baby as well. So
Okay.
we apart from her infecting the child in vitro with breast milk, there are other means, just like the education we give to any other person to protect him or herself from an infected relative. That's what we give them.
Okay. Next, I want you to educate us on how you manage babies from mothers with HIV/AIDS. But before that, viewers, let's go for a quick break. When we come back, we continue our discussion on HIV/AIDS. Next, how do you manage babies from mothers with HIV?
Pregnant mothers who are positive are offered ARVs. And then after delivery, these exposed babies are offered prophylaxis as well. In Ghana, we do 2 therapy. We give them this medication for 12 weeks. But during the 6th week, we do HIV tests for them. And then during the 9th, but that's if they are negative, during 9 months, we repeat the test again. And then after 1.5 years, we repeat the test again. But if they are positive, these babies are rolled onto treatment. We start treatment immediately.
Okay, so when you are running tests for them, are you going to use the same procedure as the one you run for adults?
No. You know, what we use as adults is the antibody test.
Okay.
But with these children, we do the dry blood sampling, what we call the PCR or DNA test. This test actually picks the HIV virus, because when we use a normal one, the antibody test, during that phase, birth till about 6 months, the child still has the mother's antibody, so it is likely to pick positive. But then, in natural sense, the child is not positive. That's why we go about doing the DNA test.
Okay. And how do you treat babies with HIV?
They are treated just like the adults, just that they are given the pediatric dosage. Their medication is the same as what we give the adults.
How long can these kids live?
Oh, with the treatment now, or with the treatment we have now, these children can live as normal and as long as any other child, if only mothers or parents adhere to the education we give them and proper diet.
Wow. And do they also have some of the side effects of the medication?
Sure.
Wow. So in rape cases, whereby you don't know the status of the person, do you give any medication to prevent HIV?
Yes.
Okay.
When one gets raped, the right thing is to report to the police.
Okay.
Then they are given letter or referred letter to the hospital. Okay. When the rape victims come, we test them for HIV. If we test you and you are positive, it means that you already had your HIV before the rape incident. Okay. And so we offer you the ARV or ARTs treatment. But then if you are negative, we give you what we call the post-exposure prophylaxis. And that is taken for 28 days. It is to help prevent the HIV infection. But this PEP, or post-exposure prophylaxis, is not given to only rape victims. It is given to health workers who are also exposed. So assuming a health worker wants to give an injection to an HIV patient, after the injection, the needle or the syringe pricks the health worker. The health worker is also offered this PEP to prevent it from getting infected as well.
Wow. So, Nurse Rita, this is very important to me. Why are women at higher risk of getting HIV? Okay,
so in a layman's term, we all know that the tissue lining the vagina is soft and can easily be bruised during sex, coupled with the fact that women are recipients. And so anytime there's a sexual act, the woman receives, compared to the man who is just giving.
Okay. Then that accounts for the high population
of course.
Women. Because according to the research, 65% of them are women.
That is true.
Okay, thank you. And one major problem that most HIV patients face is stigmatization. What will you tell the general public about stigmatization?
Well, I want to say that nobody buys HIV with money.
Okay.
It is a condition that can happen to all of us. And so what they need from us is actually care and encouragement to take their medication. Because the fact is, if these HIV patients take their medication well and suppress their viral load, it's difficult for them to infect another person. So the more we encourage them to take medication, the lesser we'll have people infecting others with HIV infection.
Okay, so meaning HIV is not contagious?
Not at all.
But it is infectious?
Yes, please.
Okay, and per your profession, what are some of the challenges that you face as an ART nurse or a counselor?
Outrightly, I would want to say that partner disclosure.
Wow.
Yes, a case where you have a woman positive, and she needs to disclose to the partner, but she says, no, I want to keep it to myself.
Okay.
Or vice versa, when you have a man who is positive, needs to disclose to the woman, and he says no. And most often, these individuals, one is positive, the other is negative. And so if only they could gather courage and tell the other partner, there could be prevention by the usage of condom.
Yeah.
But they never tell each other until the other becomes infected, and then they all roll on to medication.
And what do you do about that?
You can't do much. You keep encouraging them anytime you see them for their medication. You just encourage them to tell their significant other or partner. But it's easier for married couples to inform or disclose to their partner than people who are living together.
So, Nurse Rita, does it mean that anyone can walk into your facility to be tested?
Of course.
Okay.
Of course. And it's free.
Wow.
Just come, meet any nurse you want, any nurse at all, and just tell the nurse that you want to know your HIV status. Okay. You'll be directed to the appropriate quarters for the test to be done, which is free. And so I encourage everyone to know the status.
Okay. Thank you so much for joining me on this show.
Thank you for having me.
Great. I hope to see you soon.
Very soon.
Viewers, thank you so much for watching HEALTHLINK TV show. HIV is real, so be tested so that you will get to know your status. Join me same time next week as we talk about another interesting topic. HEALTHLINK, everything on health.
Health tips for healthy living with HIV. Practice safe sex. Safer sex is a way of engaging in sexual activity that is informed, consensual, and decreases the risk of getting sexually transmitted infections and unwanted pregnancy. Get tested for other sexually transmitted diseases. Prevent infections and illnesses. Follow your doctor's orders about your prescriptions. Don't abuse drugs or alcohol. Quit smoking. Manage physical and emotional health problems. Exercise your mind and your body.